Hi, I'm Dr. Finn and I'm here with my little friend Charlie. What I'm wanting to chat with you about today is a secondary consequence for whenever a little dog or a big dog, but we're talking about a little dog today, has an issue in their knees. They pull themselves up and they also shift their body weight over their front end. So to offload the hinds, they almost start doing a handstand, putting the pressure on the front legs. And so it's very important that we address their hind limb issues, but it's imperative that we address the tension that develops up here in their neck and the area where the neck joins the shoulders. So that's what I'm going to demonstrate for you today. And the most important thing is to recognize that it is an issue and it's very uncomfortable and it's really more in their face than their knee injury. The knee injury, whether it be luxating patella or anterior cruciate ligament, like an ACL in people, those things often couple together. But for little dogs, our primary issues are luxating patella. Charlie happened to have both, but he is so tight up here in his neck and just below his head. So, and right where his head, his beautiful little skull, meets the neck, that area is very tight as well. So in this video, I'm going to be showing you things that you can do yourself. And he's used to being here, so he knows he's going to feel good. So I'm keeping my hands wide like a starfish. And no deep tissue, no digging in there. When people say to me, oh, I really get in there, I want to say stop. And we want to do a lighter touch using the whole surface area of your hand. So I'm just stroking, moving his skin, which is moving his fascia. That's moving the fascia over the muscles. This nice, smooth, moving my hands, making little circles, but moving back and forth as well. And working on that area just in front of his shoulders. So you don't have to know the parts of anatomy. You just have to pay attention to your dog and watch their response. And you almost should feel like you're doing nothing. All I'm doing is rubbing my dog. I don't even know what she was talking about. That means you're doing it right. So it's a light touch, really like 5 grams of pressure. That's the weight of a nickel. So I'm just going up and down, and then Charlie's working with me. The fact that he's moving his head around and changing his position is really helping me out. So I'm just following and making circles. I'm going to pull him in frame a little bit. And then moving in circles again, up and down his spine. And that's really going to help all of this area free up and be a lot more comfortable for them, and really kind of alleviate a headache that you wouldn't even know your dog has. But when all these muscles are tight, just like when a human is sitting at a computer and they're tense and tight like this, it creates the same effect as that would be when they're shifting all their weight on the front. This front end isn't meant to be weighted any more than it already is, and it's not meant to be pulling them up. So I hope this was helpful. The basic point is just take a deep breath and pay attention to your dog. I know that you can make a big difference for your dog. Check out more of our resources if you have any questions at all. Thank you.